Hello everyone, welcome to our ORTHO-K Myopia Control Clinic. Today we will review how to remove your ORTHO-K lens. So first, of course, when you wake up in the morning, you would need to wash your hands and make sure they're clean and dry. And you have your station set up with the paper towel mirror here. And then you would check whether the lens is still in your eye. So first, you would check and make sure that the lens is still in the eye. So what I usually do is look at the mirror, lift up the upper eyelid, and make sure I see the blue rim of the lens. So for example, when I lift the upper eyelid like that and look into the mirror, I should be able to see the blue lens edge. Do you see that as well? And then the next thing is to make sure that the lens is not stuck or bound on your eye when you go in to remove the lens. So you can close the eyes like sleeping and take your fingertip and tap the outer corner 3 times at the top and then 3 times at the bottom, making sure you're not tapping right in the middle, never right on the lens. Always just on the side there, okay? And that should help loosen up the suction. When you blink, you should also be able to feel the lens move. So the next thing to do to help make the removal process easier is to use one moisturizing eye drop in each eye, and make sure you ask your eye doctor which type of eye drop to use, because not necessarily all types of eye drops may be appropriate, especially those that are compatible with contact lenses. So here we go, just one eye drop in each eye. Okay. And then we can go in to start removing the lens. When we go in to remove the lens, what we need to do is take the fingertip and place it right at the lower lid there so that you can tighten, pull outwards to tighten the lower lid. And then you take the other hand, reach over top, and make sure the upper eyelid is lifted up enough, but also make sure that the fingertip is not placed just too high. Often it helps if you can reach the eyelid edge like that. So again, the lower lid tight, and then use the top eyelid to push down on the lens, and make sure you have this nice setup here so that when the lens comes out, it falls onto your paper towel. One tip for tightening the lower eyelid when you go in to remove the lens is that when you pull the lower eyelid, you want to make sure it is not overlapping your lens, because if you pull the lower lid tight but it's still sitting on top of the lens, then it will actually prevent it from coming out. So again, the correct way to tighten the lower eyelid is to pull sideways and make sure it's tight against the eyeball, but you are not seeing any pink part of the eyelid. So if you're tightening like this and you see pink, that's likely not the correct position. And let me try to show you again. If you pull horizontally or sideways like that, the lens bottom should be sitting on the lower eyelid. Then you have to lift the upper eyelid like that, and then just push the top.